Our next speaker is Dr. Allison McGeer. Dr. McGeer, please come forward. You'll have 3 minutes whenever you're ready. Welcome, Dr. McGeer, when you're ready.
Thank you. Mr. Chairman, members of the Board of Health, ladies and gentlemen, my name is Allison McGeer, and I'm an infectious disease physician of the Sinai Health System and a member of the newly formed Centre for Vaccine Preventable Disease at the University of Toronto. I want to declare my conflict of interest. My institution has funding for a variety of vaccine research studies from a number of the companies that make vaccines. Sorry?
You can carry forward.
I want to thank you this morning for the opportunity to support the recommendations of this Toronto Public Health on a strategy to address vaccine hesitancy. As you likely know, vaccines are second only to safe food and water in their contribution to the doubling of life expectancy over the last century. Give you a sense of the benefit primarily of vaccines. For every 1 year that your parents delayed getting pregnant with you, your life expectancy increased by 3 months. World Health Organization estimates that between 2 and 3 million lives of children are saved every year by vaccination. But vaccines have risks, and vaccine hesitancy is a new and growing problem to the extent that the World Health Organization declared in 2019 that it was one of the top 10 public health threats. It's arisen for complex reasons, including, paradoxically, the success of our current vaccination programs, the erosion of trust in our public systems, evolution of social media, and the consolidation of vaccine production by the pharmaceutical industry. I want to commend the Toronto Public Health and the Board of Health today for taking a leadership role in addressing the challenge of vaccine hesitancy. I strongly support all of the items of the action plan put forward. Recommendations are based on solid evidence, and each one of them will contribute to the effectiveness and safety of our public vaccination programs. However, it's also important to recognize that many of these recommendations have been made by many different public health bodies over the last 20 years. Their success to date in making change is limited. I would thus encourage the Board and Toronto Public Health to consider how they can effectively support these recommendations going forward. This is particularly important today in the light of the recent loss of the Applied Immunization Research and Evaluation Program, the Senior Immunization Scientist, and the Chief Science Officer at Public Health Ontario. Leadership and coordination and innovation in vaccination programs from our local public health units in Ontario is going to be critical to our progress in maintaining safe vaccination programs in the next few years. In the body of the report, Toronto Public Health lists a number of projects they are undertaking to support immunization knowledge and practice. These programs are all commendable, and they need to be both continued and evaluated. I'd encourage the Board to support continued Toronto Public Health planning to meet the challenge of vaccine hesitancy and ongoing reporting of both goals and progress over the coming years. I would also request that Toronto Public Health and the Board consider how they might continue a leadership
Allison,
role.
I'm afraid you're just over 3 minutes, so I'm going to ask you to wrap up in a sentence if you could.
In particular, as Ontario's largest and most diverse public health unit, Toronto is well placed to support coordination of the efforts of partners and stakeholders and innovation in the development of programs to ensure the success of our vaccination programs for the future.
Thank you. Are there any questions for the deputant? I see one. Director Perks.
Thank you very much. You said in your remarks that many of the recommendations we have before us have been made many times and that we should take further steps. Could you talk a little bit more about what kinds of further action you would like to see from the Board of Health?
I think I'm not an expert in how to move forward, but I think the evaluation of programs is one critical area. So if you look at the written submissions to this Board, there's a submission from the Simcoe Muskoka Public Health looking at vaccine compensation, in which they took advantage of the University of Toronto's public health students to do the research for those reports. So I think there is a possibility of working with a variety of different universities to build the evidence case for making changes. I think it's probably not enough to make a single recommendation to a number of groups about what to do, but to try to make sure that there's ongoing recommendations and that you start a discussion going forward with the province and the federal government about what can be done. I think it's helpful to ask Toronto Public Health what they would like to do that they don't have the budget for, and on their vaccine hesitancy programs, you know, what their priorities are. Obviously, budgets are difficult for everybody, but I think if Toronto Public Health has a list of the things they want to do and you know how much they cost, there's then some practical possibility of looking for funding for those programs.
Thank you very much.
Thank you. Any other questions? Okay. Thank you very much. Our next speaker